Hey, Dr. Vicki here. So I want to talk today a write-in about a foot problem, and I don't have complete information on this, but I know that there's some ankle instability, some knee instability, and it started with the foot. So we need to ask a lot of questions. Are there supports? Was there injury previously? Is there a chronic inflammatory response? If the muscles aren't supporting the ankle, then we have instability, obviously. And so when she's walking, she's going to have some play in that ankle, which isn't good. So then that can further degrade that joint. So we need to look to see, are there joints that are out of position? She does have x-rays that she's going to send me. I have not seen those yet, so I'm not sure. It sounds like she maybe stepped in a hole when she was playing sports when she was younger, and that might have started the process. So that happens a lot, where you have an uneven surface and your brain doesn't recognize that, and so you turn your ankle without really seeing the hole. So we need to look at that. Knee problems a lot of times can be linked to ankle problems, so we've got to kind of look at that. If there's hip problems, what's going on compensation wise, and seeing if there's some issues with the lower back, hamstrings, IT bands, all of these different muscle groups. Are they firing properly? Do we have some that are really tight, that are causing some imbalance in the hips? So we have all kinds of different scenarios. It would be nice to have some x-rays of the lower back as well, to see if there's hip unleveling, see if there's looking at the lumbar spine, if there's any type of movement in the lumbar spine either direction. So there's a lot of factors that we need to take a look at. So it's not an easy task sometimes to break this all down and look at all the different things. So having x-rays of the lower back, the knee, and the ankle are going to be helpful. Upper back as well. So I would want full spine plus extremity x-rays ideally to look at this, and then do an actual exam of those areas and see if we have lack of support. There may be some swelling in and around the knees and the hips, so we need to look at all these factors. So if you have a condition that is not getting helped by whatever you're doing with all of your medical visits, give Souter Chiropractic a call at 303-385-3432 or souterchiropractic.com.